So, Kara, I want to thank you again for joining us on the patient story to share your incredible story with us.
Yeah, thank you so much for having me. It's an honor.
Yeah, so a lot to get through. Would love to just dive right in here. I know that it was in 2016 when you were feeling what you describe as minor symptoms. Can you describe what you were feeling?
Yeah, so I had a needle-like sensation on the bottom of my left foot. So it was almost like my foot was falling asleep frequently, and I just couldn't stretch my quad because I felt like there was this pain behind my knee, but I wasn't able to really pinpoint like exactly where it was coming from, and it was reoccurring for around a year or so, but I went to multiple doctors, but I couldn't really pinpoint exactly what was going on.
What were they saying to you? Oh, this is probably just a pinched nerve. Like, what were they saying?
Exactly. I mean, I went to multiple physical therapists and no one could really pinpoint exactly what I was experiencing. And they were like, it could be a pinched nerve. You could just be, sitting down too much. You might want to look into a standing desk, that kind of a thing, but nothing really concrete or definitive.
Gotcha. So that feels frustrating to me a little bit. On a scale of 1 to 10, how bad was that pain? 10 being just excruciating.
It was really around a 4 or a 5. I would say the most pain was when I tried to stretch my quad. So after a spin class, I did spin very often. That was one of the main reasons I was able to pinpoint that I couldn't actually stretch my quad properly. That was probably when it was the most painful. But other than that, it was really like more of an annoyance than a pain.
Gotcha. And so, what was it that finally got you on your way to figuring out what this really was?
So I remember really vividly, I was sitting on my bed and I was stretching after a spin class, and I was putting my hands under both of my knees, and I for some reason like squeezed or pressed my left behind my left knee, and a shooting pain went down my leg from my kneecap down to the middle of the bottom of my left foot, and I was like, oh, there's something there. And I kind of noticed that there was a tumor or something there. And I was like, it's probably just a cyst. But that definitely motivated me to get a doctor's appointment penciled in swiftly.
And what happened at that doctor's appointment?
So it was a physical that I actually already had scheduled, but I ended up moving up. And she said it was most likely a benign nerval tumor or a cyst, like I thought, but let's just get an MRI to triple check. And so that's what I did. I moved forward with the scan.
And I see that the MRI about a week later. Can you describe that process for people who've never undergone an MRI scan?
Yeah, so an MRI is sometimes it's a 30 minutes, sometimes it can be up to an hour or more, depending on the body part. But you essentially sit in this space like machine and it makes a ton of noise. And you're either wearing a pair of headphones and listening to music or just have earplugs in, and you kind of just sit there. And my first scan that was my first MRI, I believe, that actually I ever had. And I remember being like, what is this thing? And I wasn't stressed. I was fairly calm actually. But it's kind of more annoying. You just can't move for an hour. And I think for me, the most stressful part of a scan is waiting afterwards, not necessarily during it.
Right. Are you talking about waiting for the results, the scan
Exactly.
anxiety, as people call it?
Hmm.
Okay, so why don't we talk about that then? You go through this process. It seems fairly easy in enough.
Yeah.
That it's after the fact. Can you describe what that quote anxiety is like? How you dealt with it, and when you actually got results? Like how much time had passed?
So it's funny because I actually don't remember any anxiety at that point, because I was working so much and was moving at such a fast pace that I I didn't really think anything of it. And I think a lot of cancer patients can relate to this before they were diagnosed. You know, everyone thinks that they're Superman or Superwoman and pretty much invincible. So I really like didn't have any scanxiety, I would say, after that first scan. But today the scanxiety is most definitely real and there, and I don't think it ever really goes away. I think you just learn how to manage it a little bit better. And for me, I really hone in on those like rituals and routines, typically the more spiritual and wellness oriented, that really helped me stay like grounded, calm, and composed. But I mean, I vividly remember when I got the results back and where I was and how that felt when I saw that it was a tumor, but it was actually, it came back as benign. But just the words tumor freaked me out. I left work instantly.
Do you remember how long it took? Was it a couple days when you got the results, or?
From, it's a good question. I think it was like a week or so, something like that.
Yeah, yeah, it's kind of a long time when you think about.
Oh
Um,
yeah,
so
definitely.
you said that you were fine though because you were really busy. Maybe cancer hadn't even entered your thoughts, right?
No, it really, I thought it was a benign cyst for sure because all of my doctors were pretty nonchalant about it. No one was really that concerned. So I wasn't concerned. And yeah, cancer didn't even, it wasn't at the forefront of my mind at all. I think the word tumor, when I just saw the results, even though it was benign, freaked me out.
Oh my gosh, of course, right? Because we associate so many things with that word, even if it is benign. So you get the results. Was it from a phone call? Did you go back to your primary care?
So no, I remember calling the nurse at my primary care and giving her verbal confirmation that she can send me the results. I to this day don't even know if that was legal, that she was able to for me to look at those results without my doctor, but she sent me my MRI results via email. And then I read them and saw the word tumor, although it was next to the word benign. I still freaked out. I had that like paralyzing moment where I saw like double vision, and I was panicked and I left work.
And when you left work, did you go home? How did you, talk to a doctor about next steps after that?
Yeah, I ended up calling my doctor and she calmed me down and, introduced me to a surgeon and kind of to take next steps. But I mean, I remember going home and just her, again, nonchalant nature and attitude made me feel more at ease. Um, at that point, I wouldn't say I was that tapped into my own sense of self or like listening to my gut. And in retrospect, I feel like I knew something was wrong. I think I was just masking my fear and leaning on other people's opinions and words a little too much.
Right. I mean, that's natural. You want.
Yeah, totally.
Yeah. So she introduces you to a surgeon. This is just like a regular surgeon and like an orthopedics. Who was this, and how do they characterize the surgery that would happen?
Yes. So the first surgeon that I met with was the one that I moved forward with. And he was fairly arrogant and honestly confident and like overly confident, and even told me I could keep the tumor in my leg. Like it really wasn't
Wow.
that big of a deal. It was a benign nerval tumor. And I remember second guessing his energy and my relationship with him and my conversation with him, and going back to my general physician and being like, are you sure you recommend him? Is he like the best of the best? He was an orthopedic surgeon at NYU. And she was like, yes, he comes highly recommended. I personally haven't used him for surgery, but he comes highly recommended from other patients. And that's when I really should have listened to my gut, because I did move forward with that surgeon thinking it was a benign nerval tumor. And, lo and behold, we found out it was malignant after the surgery.
Okay, gotcha. Before we get into that part, can you describe the surgery to remove the tumor? Just sort of hit the major points of that whole day?
Yeah, so my surgery was just to remove the tumor, and the tumor was intertwined within my tibial nerve on my left side. So that is a nerve that kind of it gives you motor function essentially and sensation on your left leg, on the bottom of your left foot, your calf. And so we were just going in and removing that tumor. And I think overall, again, listening to other people's confidence that it was benign put me at ease. And I'm fairly fearless and trusting, sometimes to a fault. And I would say in that surgery, I was more in that New Yorker attitude where I just wanted to get it done, get the tumor out so I could get back to my day to day, get back to my, spin classes and my working out and just get my life back on track. I was more looking to just like, check the box and move forward.
I hear you. It's like a mode, right? Just get it done. Let's go, move on with life.
100%.
So, Kara, with the actual surgery, for people who haven't undergone something like that, did you go under? Were you partially under? And then how long did it take? And when you woke up or were out of the office, were you in pain?
Mm. So I was fully under. My first surgery, I am not sure how long it was. I would assume that it was an hour or two. It wasn't anything too extensive. That's a different case from my second surgery, which we can talk about that later. I was in bed rest for maybe a week. But I could really put pressure on it and kind of start walking right away. I had a 3-inch scar behind my left knee, and that is different to where I'm at today.
Okay, I hear you. And so this was relative to your major surgery. Of course, it was smaller and it was easier.
Totally.
Okay. So, but they needed to do this, and then the plan was it always to biopsy it after to make sure it was benign?
Exactly. Yeah. And in retrospect, I would have done things differently, obviously. I would have gotten multiple surgeon opinions and talked to multiple people, and maybe have done a biopsy testing before. But you can't change the past. But it was always, the plan to biopsy it at some point afterwards. Yes.
When you say you wish you had consulted other surgeons, gotten a second, third, fourth opinion,
Mm-hmm.
how did this impact the treatment or the overall situation for you? Because I'm not familiar personally with this type of sarcoma.
Right. I mean, I could get really emotional talking about it in all honesty. I mean, it could have changed the entire trajectory of my treatment. So my first surgery, they ended up leaving pieces of the tumor in my leg, thinking it was benign. And so I can't get into the details because I haven't asked my doctors that much because again, you can't change the past and you don't want to drive yourself insane. But my treatment probably most likely would have been less intensive if we would have taken a more thorough approach when it comes to pre-surgery.
Absolutely. No, and I hear you. You can't change things in your past, but I hear the
Yeah.
message loud and clear about be your own advocate, which we hear from a lot of patients. So that's your message also.
Absolutely. Be your own advocate, trust your gut, get multiple opinions. I mean, there's nothing wrong with more information that can help bring more clarity to your own opinion and perspective.
Right. And I've heard that too. I mean, the only time I've heard it balanced out is if, of course, someone's, cancer is way too aggressive and they need to move quickly. But if you've got the time to just seek out as much information, right?
Exactly. Yeah. Really, there's nothing wrong with talking to more people, in my opinion. You do have to take others' opinion with a grain of salt at times, though, because your fear can get in the way, I feel like, and you can spiral. So just take, your opinions and really get quiet and process them and unpack them in order to form your own opinion and perspective.
Okay, thank you for sharing that, Kara. And I know it was emotional for you. We'll get into maybe more of, that part later, if you're okay with sharing it. So the tumor removal, the surgery was December 1st, and then it says 5 days later is when you got that official diagnosis. So can you recount that for us? And by the way, after the surgery, did the surgeon know that he was wrong and that it was malignant already, or did he not mention anything?
No, I remember him calling my mom or talking to my mom and being like, the tumor, it looks benign, it looks clean. We're still moving forward with a biopsy anyways, just to double check. Um, but the day I was diagnosed, I remember so vividly. I was sitting in my bed, my leg propped up on a pillow, and I was working. I was working remotely and I was blogging and I was writing. I was a partnerships editor at Hearst at the time, and I was writing for 27 different publications. So I was just back at it as like in that New Yorker mentality, just like I was speaking of before. And I remember I was having routine nurse follow-ups. Nurses would call you a couple times a day just to like check in how you were feeling, how you were doing, what your pain was, 1 to 10. And I remember my phone ringing and me just picking up completely still in the work zone, not even paying attention and not realizing that it wasn't just a nurse calling me. It was actually my general physician. And I remember stopping what I was doing when she said the words, "Are you sitting down?" And I could still get so emotional. But like after that, I actually don't, speaking of like remembering it vividly, I don't remember like anything really after that. I like completely blacked out. I remember her saying the words malignant, but I was like, I don't even know what that means. Like your cancer lexicon isn't that, when you're not a cancer patient or it really hasn't touched you in some shape or form, you don't really understand this medical lexicon and this vernacular. And I remember her saying malignant and I'd be like, what is that? And then she said the word cancer. And I just remember just tears streaming down my face and my body just red hot and me just like convulsing, honestly, and just like almost dry heaving. It was a out of body experience. Like I really felt like I was in a complete nightmare and it wasn't real life. And then after that, I kind of I cried and then I went through the motions and I called my loved ones right away. I didn't even take a pause, really.
Wow, that's a lot, right? You're like in one moment just back to life normal, and then boom, you get hit with this ton of bricks.
Life can change in a millisecond.
Yeah, and it did for you. And speaking of breaking the news to your loved ones, how did you go about doing that? And do you have any advice for people, I don't know, who are going through the process of how to make it easier? Yeah.
I really don't even remember I called my mom and my dad first, and they were driving. My family lives in Colorado. They were driving from the mountains. And I remember not being able to get words out, and parents know you so well. And they were like, my dad mentioned or asked, is this about the surgery? And then I said, yes, I have cancer. And I don't even, again, like I completely black out and I get so emotional even thinking about it because I feel like your parents feel your pain so much more than you do. And then I remember calling my boyfriend as well and then like seeing him later that evening. But I think my advice for there's no right way to tell your loved ones. Like no one knows how to talk about cancer or talk about a diagnosis. It's more that you get it out. And like, for me, it was like, I think in the past, like I compartmentalized everything and held everything so close. And I think releasing that in some way, I think is so important. Having that transparent channel of communication, not even just telling your loved ones that you're diagnosed, but throughout your entire treatment, maintaining that transparent communication. But for me, with other loved ones and friends, I felt obligated to tell everyone. And I think that's something that I I would be mindful of, or I would be mindful of, yeah, moving forward. Like, this is your journey and this is your almost time to heal and be selfish. Like, it's not your duty to convey to the world or to every single friend that you were in contact with that you were diagnosed. Like, I think that's something that I put a lot of pressure on myself to do. That was unnecessary, in my opinion. But when it comes to talking to my friends too, I mean, I just gathered everyone in one place, or on one, try to condense, the calls as much as I could to make it easier on yourself, you don't have to do 100 calls, but maybe do 10.
Yeah, no, I love that advice because it's a reminder to take care of you first. You don't have an obligation to other people, which is so interesting. I feel a lot of patients feel that obligation, like, oh, now I got to do all these things.
Totally. I was like, I had a list of people and I was like, why am I doing this to myself? Like, it felt like a lot of work that was unnecessary in retrospect.
Right. So I'm glad that you shared that with the people who are watching and reading this. And moving from that, so you call everyone, and then was it your primary care doctor who again referred you to an oncologist? How did you pick who to go to?
Yeah, I coincidentally moved 9 blocks away from NYU Hospital, which was home of the oncologist that invented the cure for my particular cancer, the
Wow.
sarcoma. So I was very lucky. It was very kismet. I was not even moved into my apartment in my room yet. I mean, I was, but like I still had boxes everywhere. It was very new, but I was recommended to that doctor, and I met with him, and I just kind of, again, went with I then started to trust my gut a little bit more now that it was a more serious circumstance. But given he invented the cure for my cancer, I moved forward with NYU. But I still talk to other doctors even after and during my like first chemo session. Like, after I started, I still was talking to, second, third, fourth opinions regularly just to ensure I was on track. But given the cancer was a rare 1 in a million, more rare than 1 in a million soft tissue cancer, it was a circumstance where we had to move very quickly.
I hear you. So the oncologist visit, did I see that the PET scan was the same day, right? So
Yeah, the PET scan was on the I can't even remember. I had a PET scan, I think on the 6th, or like on the 7th, or like something around there, and then I had my PET scan before I met with the oncologist.
I see. And so that you could go over the results with the oncologist. That makes sense.
Exactly. Yeah.
So can you
I
just
don't remember what day
Oh,
specifically.
no, that's okay. That's okay. We just know that it was before the oncologist
Yeah.
visit. Can you describe the PET scan for people who, again, have not undergone one?
Yeah, so the PET scan, you get contrast, and which it can be similar with an MRI as well. You drink a awful drink. It can be like, I don't know, it's like pineapple milk. It's gross. And it's similar to an MRI in that you sit for a long period of time, but it's a full body scan. So you have this, and you can't actually like drink coffee or eat sugar for, I think it's 24 or 48 hours. I do one once a year now, but so it's not as frequent as my MRIs. But yeah, you can't have sugar or coffee like 24 to 48 hours, and it's a full body scan, and it essentially like lights up if there's any malignant activity anywhere in your body.
And so a day or two later, you're able to get the results because you just meet your oncologist. Can you describe the scan results and how he sort of characterized your cancer treatment for you?
So My PET scan thankfully came back completely clean, other than the area in my left leg where we knew the cancer was, because again, the tumor was out of my leg at that point, but there were still pieces left on the nerve. Um, but he basically took me through, the trajectory of my treatment, and that we needed to move quickly because this was a rare cancer. And I had both of my parents there who flew out right away, and they were with me through my PET scan, and I had my now ex-boyfriend there with me as well. And that's actually something I would really recommend bringing support to not only that first appointment, but to a lot of appointments, because sometimes it's really emotional that you don't really understand or remember what's going on in those appointments. So to have, a second or third person there who could be writing notes and asking questions on your behalf was really, uh, important and then like integral in my treatment.
That's really great advice, because yes, it's overwhelming. And as a former patient myself, I remember not remembering a lot of things, right? It's like,
Yeah, especially in that first appointment, but we were so confused. I was like, well, where do I go when I enter the hospital? Do I wait downstairs? How do I get, like, there were just so many different questions that we didn't ask, and it wasn't our fault. We just didn't know what to expect. But even having that, second, third pair of ears was really important to me and helpful.
and then after that, it really just a few days later, your oncologist wasn't kidding. You started chemo very quickly. So can you describe the chemo regimen that he assigned you in terms of how many cycles and how long the infusions were, that kind of a thing?
Yeah, so I started a week later, so it was very quick. I was still trying to juggle my job at the same time. I just didn't know how the chemo was going to interact with my body, so I kind of moved forward with confidence that I was going to be able to juggle both. Spoiler alert, I wasn't able to juggle both. But I personally, first, I want to note that every body is very different and every cancer is very different. But my particular regimen for synovial sarcoma was to be 6 chemo sessions, 3 high dose of ifosfamide, and 3 of doxorubicin, it's also known as the Red Devil, which is like such a horrible name. But 6 chemotherapy treatments that were not inpatient. I was able to go home, but the infusions range, from around 6 hours, I would say. And it depends. I think the ifosfamide was like around 8 or 9 days, and the doxorubicin was more of like the 3 to 5, depending on where my white blood cell count was and where my overall like blood panel, like how I was doing immunity wise. And that took 4 months to complete. And I actually wasn't able to complete my 6th session just because my body wasn't able to bounce back. I was essentially neutropenic. And then I moved forward with surgery and then 36 rounds of radiation afterwards. So
And
you really firmed up that radiation number though, way like right before I started.
I see.
It was
Before we dive into the radiation portion, I am curious about the chemotherapy you described,
Mhm.
um, which also you put it under targeted therapy. Just to clarify for people, can you describe what that means?
For radiation or for the
No,
chemotherapy?
for the chemotherapy.
So, I mean, the cancer that I had was just located around my left knee, but I mean, I got sick everywhere. Can you clarify your question?
Yeah, sure. In the timeline, it said targeted. You put targeted therapy, and then you put the isphosphamide and the dioxyribicin. So I just wanted to make sure if it was chemotherapy or targeted therapy.
No, it was chemotherapy. I must have missed
Okay,
that.
perfect. No. Just to clarify. Okay, great. And so you said outpatient. So then does that mean you went into the clinic, got a pump, and then went home, or did you? Yeah, describe that.
Yes, good clarification. I went to the hospital got infusions, but I actually was attached to a 24/7 pump when I was not in the hospital. So I called it my toxic boyfriend because it just kept on coming back into my life. But yeah, it was just like this little fanny pack that would, I remember like stuffing dryer sheets in it because it just smelled so chemical and awful. But yeah, I was basically attached to it through my PICC line 24/7. And I would go in for my infusions at the hospital, and I would get fluids and, sodium bicarb and that kind of a thing to help support my body and just keep everything in check. And thankfully, again, I was 9 blocks away. So I was able to, some days I wasn't able to walk, but most days I was actually able to walk to the hospital, which was unbelievable
That
living in
sounds
New York City.
incredible. Yeah. And to be able to walk and, be mobile. And so how many days were you having to go in basically every day for the 8 to 9 days?
Yeah, I would go in every single day. The ifosfamide was, again, longer treatment. So it was around that 1 week to 9 day mark. And then the doxorubicin, I would go in every single day. Yeah, it was around 3 to 5 days, if I remember correctly.
And then how many days would you have quote off? Was it like a 2 week thing or was it a 3 week thing or?
Yeah, so I had 2 weeks, 2 weeks off. And I would say that 1 week to 10 days right after my chemotherapy treatment, I was knocked down. I was neutropenic. So I wasn't able to completely function. I wasn't able to function at all, actually. And I would just be in bed, bedridden. And then I would have like 1 week a month pretty much that I would be able to go around the city, go to other doctor's appointments, like a physical therapist. I was working with a trainer. It was like 1 week a month that I could really live.
Wow. And so describe those side effects. You kind of talked about just being like bedridden. What were the major side effects?
I mean, I was really nauseous. I was dehydrated. I was fatigued. I definitely got sick regularly, but I was really able to hone in on what was working for me towards the end of my chemotherapy. Like I would eat food. I think one of the most important things for me being a petite woman was to gain weight rather than to lose weight. And so I would really try to nourish my body with pretty much like whatever I could get down and keep down. And so I would eat and then I would nap right after so I wouldn't get sick. But I just remember being so fatigued and just in pain too. I mean, the bone pain from Neulasta and some of these shots that happen after you do chemotherapy to help maintain a stable white blood cell count, they're so painful. The bone pain is excruciating. And I remember taking these baths at like 3 or 4 a.m. and just like filled with Epsom salt and just trying to soothe my body in any way that I could. Baths were a huge ritual for me that I really started to integrate into my routine and that I still do all the time today. But yeah, fatigued, nauseous, and that bone pain were really the main ones. I
Yeah.
also did actually mouth sores.
Oh,
Mouth sores were I got a few really painful mouth sores as well.
I'm glad you brought up Neulasta and all these other side effects. What helped you? So baths helped you with the bone pain. Did you also hear the whole Claritin thing? Like take Claritin, it'll help. And
Yeah, I feel like that didn't work for me in all honesty. I took it, but I still had crazy pain.
okay.
Um, there was another one outside of Neulasta that I'm forgetting the name that actually worked. Neupogen.
Mm,
Neupogen worked better for my body, and I think that's just bioindividuality is so real. Everybody is different, and so those were the two options that I had: Neulasta and Neupogen. But I feel like the Claritin really didn't do that much, if I'm being honest.
yeah.
Things that worked for me, though, again, baths were huge. Like seaweed baths, Epsom salt baths. I used pure soma baths a lot just to ease body pain and just help me relax. I really started to lean into a lot of spiritual modalities, and it was almost, I didn't go to therapy during treatment, but I worked with spiritual counselors and healers. And so I went to Reiki all the time, which not all the time, but in between every chemotherapy treatment, which was huge. I started to meditate regularly. And I really leaned on my like family and friends as, I mean, I had an incredible support system and they were really my army, and I was able to get through my treatment and the cancer because of them, because of their support, and just having that cathartic release just by talking and having these raw and real conversations.
Yeah, no, and so I'm hearing you got support from every direction, and it was really helpful for you to move forward.
Absolutely.
Speaking of, I mean, one of the biggest side effects, of course, is the hair loss. You and I actually went through treatment around the same time, and so I think our hair is about the same length. But like, yeah, that's it looks great. Um, can you describe the hair loss when it started coming out and how you felt? What was the best sort of approach for you to minimize that pain?
I remember that was the first question that I asked the oncologist actually in our meeting. I mean, I come from a fashion background and I feel I was a young 20-something-year-old, and it was like, am I going to lose my hair? That was my first question that I asked. And it's part of your identity, as a young 20-something-year-old woman for sure. And it was really tragic for me to think about, but I had, and my doctor was like, I would get it cut right away. And so I started chemotherapy, and in the middle of my chemo session, my first chemotherapy session, which was a high dose of ifosfamide, so it was about that, 9-day long chemo session, I had all of my friends come with me to Bumble and Bumble and Meatpacking in New York City. And they gave me a private room, which was so sweet. And we like threw a dance party as I cut my hair in a pixie, and my hair wasn't really falling out yet. But I kind of wanted to just get to it and, maybe try to cut it so I could donate it or make a wig out of it, which there's a very particular way that you need to cut your hair if you need it made into a wig. Like, I even talked to my stylist, and she said they said they were going to do it correctly, but it ended up being the wrong way. So I wasn't able to make a wig out of my real hair. So do your research on that. But yeah, I got a pixie cut, and although at first I thought it was going to be a really traumatic experience and emotional experience because I had such an amazing support system. It was almost like a celebration, like this liberation. It was a bizarre, looking back, it's actually a very bizarre feeling and experience for that type of situation. But I really have to thank my friends and my support system for having that be more of a celebratory moment in my mind rather than a really sad moment. But I think, not to say that sadness didn't kick in, because it did. And at that time, I would say after I finished my first treatment is when around the 2-week mark, I really started to see my hair falling out. And it was around New Year's, and I remember waking up next to my ex-boyfriend, and my hair was just covering my pillow, and I had a porch right off of my room, and I remember just shaking my pillowcase on my porch, and my ex-boyfriend waking up and being like, what are you doing? I was like, my hair is just everywhere. And that being just so hard for me. And I was like, I just need to buzz my hair. And I ended up going to a salon down the street, which I would not recommend doing. I would recommend getting a hair buzz, like a razor, or not a razor, but you know what I'm talking about, one of those electric razors, and doing it yourself, because post chemotherapy, my immunity was low and I ended up getting a rash on my head. So it's better if you just buy your own hair clipper and do it yourself. But I went to a random salon down the street, and had someone else do it for me. And again, brought my friends there and tried to make it a more celebratory experience. But that was when I was really in kind of a darker state. And I was also starting to feel more sick. And so that was a little bit harder for me. And then I would say I was fully bald probably a month in. It really was quick. It was quick for sure.
So looking back now, I hear that you had a great celebration for your first cut. You turned it into more of a party than a grieving sort of a time. And then when the hair actually started to come out though, and the chemo was really hitting you, of course, it's just harder. So you had to kind of power through that a little bit more. Is that right? Just
Yeah, I just I had to be a little bit more gentle with myself. And I was just I mean, as you go through treatment, more emotions start to unearth, and you start to go through, this roller coaster and this tumultuous health journey. So in the beginning, it was definitely lighter, and I really was starting to immerse myself in this dark journey. Not to say there was bits of light around along the way, but yeah, I think it was just really harder to deal with as I started to look more and more like a cancer patient.
there it is. Yeah, and we'll definitely talk about that, the looking like a cancer patient portion of it. But back to your treatment. So it says you wrapped chemo mid-March. What was that conversation with your oncologist in terms of, okay, next steps is surgery? Did you have a scan? It looked good enough to
Hmm.
go forward?
Yeah. So again, I remember going back a couple times for what was supposed to be my sixth chemotherapy treatment, and my counts were just not rising. I could not get my body back to a point where I could take another round of chemo. So we ended up deciding and landing on 5 chemotherapy sessions, getting a scan pre-surgery, and then moving forward with a tibial nerve removal, which I had multiple options there as well. I think there's a spectrum. There's a liberal, where it's like a liberal surgery on one end and then a more conservative surgery on another. And I could have taken out part of my tibial nerve. I could have taken out, or I did take out my entire tibial nerve, but that was one option, which was in the middle of the road. And then the most, liberal option was amputation, which, or more radical, I should say. That was the most radical option that had the lowest rate of reoccurrence. But again, this is a decision that's unique to every single person and their age and where they live and what they do. But it really resonated most with me to take the middle of the road option, and move forward with tibial nerve removal. And again, that was a decision that I didn't take lightly, obviously. And I talked to multiple doctors and multiple surgeons. And in addition to my chemotherapy, the decision to stop early, I talked to multiple oncologists and multiple doctors to ensure that I was taking the right route and that felt best for me. At the end of the day, no one's decision, it's your decision. That's the most important, and you have to feel good and confident moving forward with that decision. And so,
Yeah, and you made the best decision for you. And the oncologist, what did he say in terms of the chances of it coming back without amputation?
you know what, I have so many notes on my computer that would take my computer into every single surgical consultation and conversation and write down all this data. I have not ever looked back on that, so I actually don't know the percentage, and I have not Googled the rate of reoccurrence or anything like that. I've only Googled my cancer twice, actually, because I'm a writer and I had to write about it. So I actually don't know the full rate of reoccurrence, and I can't even remember. I think I probably have a little bit of PTSD and just blocked it out of my memory.
No problem. You made your decision. Obviously, the numbers made sense to you at the time. And
Exactly.
so then the scan, again, you did have one before the surgery, after chemo, before surgery. And do you remember the difference in terms of what it looked like before chemo and after?
Um, the decisions, I'm sorry.
Yeah, the decision between chemo and surgery, did you get a PET scan done again to show how the chemo had impacted the cancer?
Right. So I have a very unique circumstance because, again, I didn't have a tumor in my body. So we couldn't see if the tumor had necessarily shrunk or not. The pieces that were left in my body were so small that we weren't really able to see if there was like a material difference in size.
Right.
But overall, we were just optimistic. I think just feeling the optimism that it was working, and that my body, again, like I had a clean PET scan, so there wasn't that much of a benchmark to see whether it was working or not.
Right.
I've never really thought about before. But yeah, I just had a different circumstance where I didn't have a tumor in my body, so we really didn't know.
Right. And so, okay, the point is it was all go for surgery. And that was about a month after chemo ended. So can you describe what you remember of the surgery, going under completely again, and the recovery especially?
Yeah, I was in full on warrior mode at that point. I mean, I was just moving forward. I think I really wasn't showing that much emotion at that time. I think, again, my family and friends and my loved ones were feeling it for me. And then I took time afterwards to like feel the feels, but it was a really long surgery, really extensive. It was 8 hours, I believe. And I went in thinking that I was actually going to lose motor function of my left foot. So I was going to have drop foot. And this is something that, I was really mentally prepared for, and that I spoke about with my surgeon very frequently and with my friends and family often. And I had all these tools and these like wraps and things to help me recover already. And so I was mentally there. But after I got out of my surgery, I remember like waking up in my recovery bed, and I was able to move my foot instantly, which was like, I had a miracle surgery. They were able to save this motor function of my left foot because the tumor placement was actually like below. I mean, I'm not well versed in like a ton of medical lexicon, but the tumor was basically placed below where they needed to take out or something. And so essentially they couldn't see what they could see. They couldn't see anything in the scans that would like really show that I was going to save my motor function. And so they were able to see it when they opened my leg up.
Yeah.
But in brief, it was a miracle surgery.
And I see you getting a little emotional.
Yeah.
Can you describe that? What's going on for you?
I mean, it was just like, my life could be completely different. My doctors told me that I was like never going to do yoga again, or never going to run again, or, do all these things that I am so blessed and so grateful to be able to do today. And like, it's crazy that like your life can change so much, and to realize that this can happen to anyone as well. And so I'm just so blessed with like my journey. And I think it's like, I really have to thank like not only my doctors, of course, and my nurses and my community, but I mean, I wholeheartedly believed that like I was in a miracle surgery. I remember like working with a Reiki healer and a spiritual, and I am very like woo and like spiritual. And she was like, you just have to believe in a miracle. And I was like so steadfast and like moving forward. And I was like, I will be fine. And I remember telling my doctors after, they were like, you might not be able to run again or do yoga again. And I was like, you don't know me. And I think like, although people say so many things that can cause roadblocks in your mind, to always keep that positivity and that optimism, because like miracles can happen, as cheesy as that sounds. And I'm living proof of that.
Yeah, I was so happy for you. And thank you so much for digging in and sharing that. It's clear that you have this gratitude you live with. And
So, like utmost gratitude. Yeah.
yeah, and
It's like a full embodiment.
that energy is really emanating off of you. And so I'm hoping people really can soak that up too. So it was a successful surgery. I mean, more than successful, as you
Yeah,
described.
more than successful.
And so you weren't done with treatment yet. It was great news. And then the last part of this was to do this radiation, 36 rounds, which is that 36 days, essentially?
Yeah, 36 days, which originally it was like 30 days. And, but we had to bump it. I can't remember why we increased it. It was just like the final, I think they just like wanted to take a more aggressive approach. So yeah, it was 36 days of radiation. And I actually was split at that time, which I didn't mention before, between NYU and MSK. So my radiation and my surgery, because I was more diligent about getting second opinions and meeting with different surgeons and different doctors, my oncologist was at NYU, and my surgeon and my radiology, my radiology and my radiation was all at MSK. So I actually did a split approach at the end of
I
the day.
see. Okay. Wow. So you really went forward with the second opinion. You went to
Oh yeah.
Sloan Kettering. Okay. Perfect. And the radiation, how was that? How long was each session, and was it painful? Did you get the burned skin?
So how long was it? It was really short. I started going to radiation fairly quickly after my surgery. Like a few weeks after my surgery, I started going to radiation, and I remember I was actually back to work during during radiation as well. I was doing half days. I can't remember the exact amount of time, but I just remember it was way quicker than what I originally thought radiation was going to be. You know, it was 10 to 15 minutes, and I could listen to my music. And that's really when I started to lean into meditation a little bit more, and definitely got extremely fatigued. That was apparent. And I did get burns, but I mean, I am a beauty enthusiast, a clean beauty enthusiast, and started to lean into that more, as well as I started to expand my knowledge of like wellness and spirituality. Clean beauty was a part of that. And so I used so many different oils and products and lotions. And so CV labs being a major one, in addition to the one that I was given to by the hospital that I applied liberally. So I did see burns, but the latter part for like a couple of weeks, and I saw peeling and everything. But again, I was really diligent about applying serums and creams and oils and all the things.
So it sounds like you moved through that part of your treatment pretty well.
Yeah.
And it was maybe also the fact that it was ending was probably great. So discuss that end when the oncologist was like, okay, like Kara, we're good. I mean, how did that conversation go?
It's bizarre because I remember being like, wait, what? Like you wait for that moment throughout the entire treatment journey, and you're like, I'm so excited for that day. I'm so excited to ring that bell. And then when that day comes, which the ringing the bell is after chemo, but when that final day comes, you're like, wait, it's like you're losing that support, which was for me a mental switch. Like I was leaning on them so much that it's kind of like, you know, you're flying the coop, and it can be really scary. So it was like a ton of mixed emotions, which I feel like is completely normal. And you know, you're celebrating, but then you're like really scared at the same time. But that's kind of what life is about. You know, there's so much uncertainty day to day. You just have to keep on moving forward. But overall, it was such a beautiful and celebratory moment. And I flew back with a ton of my friends to Colorado, and we had a, you know, celebration. We had a party, and and at the end of the day, you know, tons of mixed emotions, but the majority were so positive, and it was just a huge sense of relief to not be living on this timeline where I was consistently looking 2 weeks down the road to my next chemo treatment, or to my next doctor appointment, or to my next scan, which obviously I have scans regularly now, but it was just different to live on a timeline that was more mine and my life rather than the doctor's.
And some more power, some feeling of control anyway. And you know, I actually forgot to ask you, because I'm sure you got your PICC line taken out, but how did the PICC line work for you? Did you like it?
Yeah, I liked the PICC line, and I have like a very small scar still from it, but it ended up working really well for me. I went on Amazon, and I had all different types of covers, and I had different like shower bags that would help keep it dry. And yeah, it wasn't really like it wasn't painful at all. I remember being so scared to get that PICC, and it was nothing. At the end of the day, I mean, it was more emotional than physical pain. But I remember it was a really emotional journey when I got my PICC line out. I just like burst out crying. It was like a huge milestone for me to get that PICC line that had been in my arm for months and a part of me and a part of the journey. It was such a release, physically, mentally, emotionally, all of the above.
You know, wrapping this now into the last portion, we're just talking about all these emotions. How were you able to get the support, not just emotional support, you touched on that from your friends, but even just day to day? Like, did you need support in terms of like meals or rides, or you just even asking for support in general? I think a lot of cancer patients find it difficult to do that.
Yeah, that was one thing I was very good at was transparent communication because I just didn't have the energy, but I definitely needed support. I mean, today we have Uber and Lyft, but I had to be careful when my counts were low to be using those types of vehicles and to be very cautious of germs and wearing a mask and everything. So I had support from transportation there. Meals, I was very lucky to be connected with a lot of meal delivery companies through my journalism and like my editorial background. So I had Sakara delivery regularly and Provenance meals, and I definitely used that in addition to Seamless. You know, I think that was a great gift for me because I was ordering so often in New York City. So a lot of people got me like Seamless gift cards and everything. But I was able to make that work because I was so transparent with my community, with my friends and my family on what I really needed and when I needed help. And actually something that was really amazing for me that I did in the very beginning before I got really sick was made a Google calendar of all of like my chemo appointments. So I had a group text. I didn't use Caring Bridge or anything like that, but I had a group text with all of my friends and family. And I basically just sent my Google link that had a Google calendar of these dates. And I'm like, this is when I need support. This is when I need help. Well, you know, and they kind of, again, I have such an incredible support system that they were able to, you know, all take charge and pick a day that worked for them if it came to like working remotely or anything, or taking some time off. I really had an incredible support system. But it was really about me creating the infrastructure for success.
I love that though. Yeah, because you have to, right? You have to draw the boundaries and then you have to do the transparent communication and just ask what you need. Okay, so that's wonderful. And before I forget, my last question to you before I open it up to you is you had talked about looking like a cancer patient. And I think this is also in line with dealing with cancer as a young adult. If, you know, how did you sort of process all of this, and any guidance to people who are either about to go through this or are in the middle of it?
It's a really good question. I don't think there's any way to process it right or wrong. Um, it was really hard for me, like looking in the mirror and seeing myself change and not looking like myself. That was really when I started to embrace a deeper journey of like self-care and self-love. And this sounds cheesy, but like really like embracing affirmations and saying them out loud to myself in the morning as I looked in the mirror and as I was seeing myself, but looking like a bald alien and being like, you know, I still love you. Like you are healing. Like I am healing. Like I am love and I'm still beautiful. And I think one thing for me, coming from a fashion and editorial background, I actually had photo shoots scheduled like when I was healthy and when my immune counts were good in between chemotherapy sessions. That made me feel like me again. So I used Rent the Runway and I would get dressed up and like that just, those moments like were so fun for me. And that can look different for, can look to any other person, you know. It's just, I think, accepting that you're in this state and making the best of it, but also like doing things that make you feel you again. I don't think there's anything wrong with that. And photo shoots was a big thing for me. And like getting out every now and then with my friends was a big thing for me. And one thing that I did with my girlfriends, we had like a wig brunch oh gosh, what is that club in Brooklyn? Yes. Oh my gosh, I forgot. We went to this like really fun brunch place though, and all wore colorful wigs to like celebrate the end of my of my treatment and my journey. But again, I think there's no right or wrong way to deal with your physical body changing throughout treatment. For me, it was just about embracing a deeper sense of love and acceptance,
Yeah.
and trying to, yeah, I find a deeper sense of love, because I think that going through cancer did that for me. It provided a deeper perspective on life, and a deeper appreciation for just my body as this beautiful vehicle and this vessel of life. Whereas coming from the fashion industry, you get a little caught up in the facade and the material things. And when you're stripped down to just your core, you have nothing else to embrace but that.
That's a beautiful message. That's beautiful. Like deepen your self-love, really look at who you are and embrace that. Is
Mhm.
there anything, you've just been so wonderful and sharing everything with us. Is there any last thing you want to say to people? I feel like you've covered A to Z a lot.
I think the last thing is that it was a dark and, pardon my French, but a really shitty, tumultuous journey going through cancer and through treatment. But at the end of the day, it has been such a positive catalyst and a conduit for change in my life. I mean, it enabled me and motivated me to launch my own company and to embrace spirituality and bring this mindfulness to the masses, and share my story to help others. And it's been a beautiful journey at the end of the day. And I'm not grateful for my cancer by any means, but I'm really grateful for the transcendence that came about from my trauma. And that was something that post-traumatic growth is not out of reach for you if you're a cancer patient and you're going through this journey. Like, post-traumatic growth can happen. It doesn't always have to be PTSD. And I
Right.
think that's something that I'm really embracing right now. And I feel very grateful to be on this upward, journey.
I love that. PTG, post-traumatic growth.
Yeah.
Thank you so much, Kira, for spending all this time with us and for, bringing all of you to this, this chat. Really appreciate it.
Oh yeah. Thank you so much. It's been it's really cathartic for me to help, to share more and more. So it's really an honor. Thank you so much for having me.